These are the Manyaras. Today, Grace Manyara is escorting her son, 23-year-old John Manyara, to work. John is autistic, a developmental disability that can cause significant social, communication, and behavioral challenges. Autospectrum disorder, ASD, affects 1 in 68 children worldwide, according to the United States Centers for Disease Control and Prevention, CDC. In Kenya, statistics haven't been quantified on the number of those affected by the disability. John is one of the few autistic youths in Kenya who engage in gainful employment. He works at Karatasi ya Hewa Safi, or Kahesa, which when translated means eco-friendly paper. 3 years ago, Simia Ahmadi began Kahesa with her personal savings of $12,000. Her staff makes handmade paper from banana bark and rice husks, which she then sells at exhibitions, schools, and trade fairs. On average, Kahesa makes approximately $500 a month, which is then used to pay the workers and buy materials. Ahmadi began Kahesa with the sole aim of generating income for young adults with mental challenges.
I hope that after 2015, they will be integrated into a regular professional field so that they are now included in the workforce and not isolated, because once they have the vocational training here, they should not stop at that. They must fly with their own wings afterwards.
Grace Manyara runs a cyber cafe in Nairobi. For 10 years, she struggled with the lack of awareness in how to manage autism. According to her, stigma is the biggest challenge that is yet to be overcome.
It's a hidden disability, so there's nothing to show that he has a disability. So there's a lot of stigma. There are others who think that the child is bewitched, kurogwa in our language, and which is not the case. It's a manageable disability if it is handled well.
James Karanja is the founder of the Autism Support Center Kenya. He notes that the government has neglected the plight of those with autism and should do more to reduce the stigma attached to autism.
We need increased funding to institutions that offer training for persons working with those on the autism spectrum. These are the teachers, specialized teachers, medical personnel, we need therapists, and also bringing more awareness. So it's actually the government who should be at the forefront to bring more awareness so that the stigma and all these other issues affecting those with autism are reduced.
Although the Kenyan government cares for the disabled through the National Disability Fund, those with autism aren't looked after as closely as they should be. It is hoped that with more pressure from lobbying, the Kenyan government will accord ASD the strengthened policy and interventions it deserves. Lenny Ruvaga for VOA News, Nairobi, Kenya.